Okay, we got it. So I'll go ahead and get started. Yes. Next slide. Yeah, thank you. Okay, so I want to start out with a little bit about the National Indian Health Board. NIHB is a 501c3 charitable organization created by the tribes over 40 years ago. We're coming up on our 50th anniversary, and we're going to have with our next conference in September, we'll be in person in Washington, D.C. So I want to share that out too. It'll be our conference and also our 50-year celebration. We're created to advocate for improved health for our people. NIHB is the only national organization of its kind. We serve federally recognized tribes and advocate on all issues related to health and public health in Indian country. Along with many other services, NIHB provides policy analysis and real-time communications to tribes throughout Indian country. We do this work in partnership with our members, the area Indian health boards, and places where no health boards exist with tribes in the region. NIHB, we are your organization. Our staff, we're here, and board members, we work for you. And we're not an external organization. If you have any issues that are your priority, we want to hear about it. And really that's what, along the lines of why I wanted to have the discussion first before the presentations. We do have a couple of great presenters lined up, but that's kind of usually if we have all day of presentations and then discussion, we're getting kind of tired and and not as engaged. So that's why I kind of flipped it around. So NIHB and Project Firstline. So we're grateful for our partnership with the CDC on Project Firstline. The project is to support the implementation of our national tribal healthcare infection prevention and control training. Historically, American Indians and Alaska Natives have experienced disproportionate mortality rates from emerging infectious diseases threats, including the H1N1 pandemic, and COVID-19 was no different. And it impacted tribal communities and our AIN relatives, and we continue to experience higher risk for infections and COVID-19 related mortality. To address the gaps, we implemented a multi-pronged approach to provide infection and prevention and control training and technical assistance to tribal health officials and tribal health systems. Our focus is on raising the collaborative capacity of infection control professionals and healthcare providers to undertake infection control practices within their respective scopes of work. So really, especially in the beginning of the project, we started out in kind of late 2020, or maybe around August, like kind of mid 2020. And we found that the tribe's needs, were really different in that we wanted more focused training on really your job, the training that's going to be the most helpful for you and your job. So we were the first ones to provide focused training for dental infection control and for dental healthcare, and one of the first organizations to also provide focused infection control training resources for the EMS, for emergency medical services. So that's really what our approach is making sure that the things that we are working on will help you in your day-to-day work. And we do have a goal to work with the CDC and other partners. So there are several partners with the CDC on this program. So anywhere from the American Nurses Association and the AMA and state health boards are also some of the partners. It's a really big program, and I think a lot of you here have used some of that I've talked to have used some of the CDC resources as well. Okay. Yeah. Next. Thank you. So, so for NIHB and Project Firstline here, this is a list of some of the opportunities that we have. We have funding for scholarships. We have awarded sub-award funding, and we're working on online self-paced learning modules, and so we have some job aids. We are just recently launched the Infectious Disease Threat Hub. It's kind of in timely with this regional institute of having the Infectious Disease Hub, because we used to have, well, we're still getting all the promotion out, but we had 3 web pages. One, there was a separate COVID page. There's a separate page for this project for the infection control, and also an infectious disease web page. So we've combined all 3 of those into one web page, and with all the resources for each there. And we'll be able to share that link in the chat probably later, before we get started on the later presentation. And so we had a National Infection Control Institute, and this is the regional institute that you're attending now. And we also work on webinars. Okay, next slide. Okay, so a little more about the scholarship opportunity. We're really excited to provide scholarship funding for tribal infection control staff and healthcare workers to complete courses to help improve their ability to prevent infections. So a lot of the awardees that we have awarded so far use the funding to complete the APIC training courses, and it can also be used for those who are have worked in infection control and are ready for the CBIC. We can use that scholarship funding to complete the CBIC exam, or any of the training, because there's a lot of training resources for exam prep. So we can provide that as well. And also before the next session, or next part of this session, before the presentations, I'll share the application. And we have recently opened it to also, like I mentioned, that we've worked a lot with, or had a lot of dental interest. A lot of the dental community reached out to us about infection control. So we also extended that to those wanting to complete the CDITC exam, which is the dental exam. And we believe that providing the scholarship opportunity will enhance the important work that you do for your tribe and your tribal health organizations. Okay, next slide. Okay. So we've recently awarded the sub-award funding to assist tribes to implement their own infection control training in their facilities. We've awarded 5 sub-awards, and the advantage of this is that the awardees are able to really focus. You know your needs for infection control in your facility, and we're happy to be able to assist in the work that you do, and but identifying training program and tools that you need to assist your staff in. Some of the awardees are creating additional job aids that are more focused on what they're seeing day to day is being needed, and they'll host local webinars in their area, as well as have some of their staff also complete the CBIC exam. And the goal is to support future infectious disease outbreaks within tribal communities. Okay, next one. Okay, so we're also working on, we haven't launched any of the online learning modules yet. That was turned into a longer process, but we're continuing to work on them. And the concept of them are to be quick learn training tools that can be taken on several, multiple different devices. And the topics include source control, safe practices to prevent needle sticks, and other infection control topics. The modules will be in a slide format with some embedded videos and then quizzes at the end. So our goal is to keep them short, something that you can have staff can do on a break, or for new staff, something that won't take them away from the area too long from working. Okay, next slide. So the job aids that we have available now, we have a couple, we have the what is infection control, because we found a lot, distincting between what is infection control, so just distinguishing between infection control and other infectious disease, and that the infection control really focuses on the day-to-day practices that healthcare workers take to prevent spreading infections in the workplace, rather than the community response. And we will have them, those are available on our webpage. And the other thing I wanted to mention is that if you wanted us to provide copies for your healthcare facility, you can reach out to us, or even if they can be optimized to make poster size, so we can do that too. You just email me to request that, and we can do that. So we have a few that will be coming soon. So we really wanted to kind of shift our focus on just infection control, not just COVID-19, because it's really based on the feedback from tribes, webinars and surveys that we've conducted, and we learned that there's really a need for not just COVID-19, but just so we're going to shift on bloodborne viruses and respiratory virus other than COVID-19, as well as some environmental services and cleaning will be the next ones. Next slide. Thank you. Okay, so this is about I mentioned the hub earlier. So that we will share that link later once we get it. I'm sorry we don't have it on hand right now, but it was just very recently launched in the last few days before we came out here for the Regional Institute. But as I mentioned, it will contain all the Project Firstline activities, but we'll also have our COVID-19 resources, and then hopefully will help us to keep one calendar of all our webinars coming up too. And Munez, who's joined us, she works on our COVID-19 side. So, and one thing that I do want to mention with that, that is an ask that I have for you, is we also have an area set aside for in the hub to share infection control, epidemic, and outbreak plans. And if you have any plans, that for your tribe and your organization that have worked very well for you, and we'd like to share that and highlight your work that you've done. Email me and we can get that shared on our hub.
Is this hub on the NIHB website?
Yes, it is. Okay, next. Thank you. Okay, so that brings us back to the Infection Control Institute. As I mentioned, we had a national institute back in April, and at that institute, we had sessions on exploring the importance of infection control in tribal healthcare and how it's different from non-healthcare settings. Dr. Abby Carlson from the CDC was one of our presenters, and We also presented on exploring the importance of infection control, or where germs live and thrive in healthcare settings. Sorry, I read the same one. But so that was similar to this. It was about a 4-hour institute, and we had recorded those. So those are available if you'd like to see that. Next. Yep. Okay. So upcoming webinars, we have a lot of our webinars already shared on our, the previous webinars are all recorded and shared on our webpage as well. So with those recordings, you could either watch them individually for yourself, but if you are a trainer, we do encourage you to use those videos. If there's interest, you can use those videos how you like to do your training. We've had one of the presenters had used our videos in a national conference as well, and as part of their resource in their presentation. So we are planning additional infection control learning community webinars in the next couple of months. So I encourage you to just be on the lookout for those. We're planning a basic concept of infection control and variants, but I would love to hear back from you on the topics that you would like us to have webinars on, because like I said, everything that we do is really direct feedback from tribes and everybody who has reached out to us to let us know what your training needs are. So I do encourage you to reach out to me, and for planning webinars, I'm open to planning those when we can. And then we're also planning listening sessions. And the listening session will be similar to what we're planned for the discussion session here. It's really more of an open forum for to give the opportunity to share information about your work and really share with each other what worked really well, because a lot of the feedback we get from tribes is what are other tribes doing? What is everybody else doing? You know, what worked for them? And obviously, you know, what we always say, if you haven't worked in a tribal organization, the biggest misconception is that, you know, it's kind of a one size fits all. And we know working in tribal healthcare that it's not. So really, you know, if we have to, what part worked for you, and share that with somebody else, but how can we adapt it to fit your needs too, and we'd like to have, you know, those conversations to be able to connect you with each other, and also for us to connect with you and make sure that we are providing the resources that you want of us. Okay, next slide. Okay, so this is just the agenda for today. So the first portion, like I said, we'll have my project Firstline, and then we'll go into the conversation and discussion session. And we'll break for lunch from 12 to 1, our time here. And then when we come back from lunch, we'll reconvene for those of you in person, we'll be in the same room. And for everybody on Zoom, it will be with the same Zoom link. And when we return from there, we'll have a presentation on the role of an infection preventionist and the challenges in navigating infection control training for accreditation. We'll have a short break, and then we'll have 2 additional presentations, recognizing and reducing risks to healthcare workers during the screening and treatment of sexually transmitted infections, and then screening and treatment of sexually transmitted infections. So what we'll do is with that one, we'll talk about the infection control portion, which falls under the Project Firstline umbrella in this presentation, but we added the additional presentation about the screening and treatment, which doesn't fall under Project Firstline, but it was a topic that we wanted to cover since we were already covering the infection control portion as well. And that's all I have. Does anybody have any questions for me in the room? Or Sure.
So on one of those slides, you had infectious control, something, healthcare setting. Do you guys have anything pertaining to like within the household or all that?
No, we don't, because Project Firstline really focuses on infection control for healthcare workers. We do understand that some, that it crosses over a lot, especially when we're talking about CHRs and or even the healthcare worker when you go home too. But that still falls under infection control for healthcare workers. But right now we haven't worked on any community that would really be community health, and we haven't had any of that type of training yet.
Yeah, that
for community response.
That would affect also that kind of training that my purpose of being here. Indian child welfare, part of our oversight is to make sure in the event of pandemic that our children are taken care of.
Right. Yeah. Yeah. And that's one thing that we understand too, is that it really, especially for our tribal communities, it really crosses over that the schools and, we're more of a full community response is the healthcare response. And we can do some of that work, but we can do that with NIHB, probably with other projects that we can help coordinate. It wouldn't fall under my umbrella for Project Firstline, but if you, we'll put my email address in there, and we can talk about that, and I can talk to my colleagues and see if we can plan something together that we can have some of that training.
So that's like a sensitive area,
right?
Because, some of our families, our relatives and stuff, environment. We have bed bugs, we have in the backyard, have like trash, and then you have rodents, stuff like that. So
right.
A lot of disease or whatever can be spread.
Right, and yeah, and that's can cause an increased risk. Yeah, exactly.
Like I said, it's a sensitive area.
Yeah, because sure.
So I'm not the right tribal leaders help work, so I would imagine since we work on tribal, but it got me thinking about other organizations like self-community health that are like off reservation, but they're still serving natives that are in more like urban.
Right.
Is that something that they do?
Actually, we do. The National Council of Urban Indian Health is another one of the partners here too. So they have resources for the urban Indian health centers too. So and we are planning. We're still in the early planning phases of partnering with them and doing. I think they're. It's not confirmed, but we were talking about having a couple of podcasts with them where we can have where we Okay, sorry about that. I'm back. And so we've had some great questions in the room here. Do we have any questions for anybody? Any other questions? Yes, we have one more. Sure.
So, you mentioned that you can see.
Right.
Yeah, website or...
Yes, we the question was about the sub-award funding and where do we post that at? Yes, we did have it posted on the webpage, as well as I don't know if you're familiar, we have a bi-weekly newsletter that goes out from our public health. If you want to join that list, you just have to go to the main NIHB webpage, NIHB.org, and there's a tab on there to click on to join our mailing list, and you'll get all the announcements there. And you'll get the announcements from actually all our programs, not just this, not just the infection control. We share that we have. We do have behavioral health programs that we're working on, as well as we're here with the infectious disease, as I mentioned, that infection control and COVID-19 and infectious diseases, which behavioral health, remind me some other ones that we have, Munez. We have, yeah, but you'll get information about all the opportunities that we have with NIHB.
So you have an application process? And
yes.
Funding?
That one is actually closed. We just recently closed up. Yeah. Generally it takes about a month from the depending on when the application is closed, and then we'll go through and yes, yeah, depending.
Once there's an award, is it cost reimbursement or is it an award?
The award for the sub-award funding is an award, and to do the, you'll have your deliverables defined with the application, and it can be used for you to meet those deliverables. It's not all one lump sum though, it's split up for the first half until you do, reach the first part of the deliverables, and then work on the next sort of deliverables until it's, until you have the complete funding. And the scholarships, however, are for the training scholarships are reimbursement. So you would present us with the certificate or the purchase, like if you purchased a training book or something that's on infection control, then we would reimburse you for that, for the scholarship recipients.
Thank you.
You're welcome. Okay, and did we have any other questions? How are we doing on time? Pretty good. We're doing pretty good on time. Okay. So I think since we don't have any more questions about Project Firstline or about the programs with NIHB, we'll go ahead and move over to the discussion session. I wanted to invite Mandy and Gina up. They're going to be our presenters this afternoon, or if you feel comfortable back there. But we really wanted to.
5 minutes. We need to switch because I'm getting out of power. Do you need to prepare? And then I need to do it. If you want to show something.
No, actually, we don't really have to show. Yeah, we don't have anything to share with this one. How are you guys doing online? Can we get some reactions here? See, how are you all doing? You can be in front if you are. You more comfortable there? Okay. Oh, good. Andra's doing well. I see a thumbs up. Is that you, Andra?
Yes, hello.
And okay, we're just shifting around in the room here a little bit. So I just want to make sure we're communicating with you all online still. Best we can in our virtual, hybrid virtual in-person mashup here. It's been a while since we've done this. So really I want to get started. So I had Gina and Mandy join us. Gina is an infection prevention employee and employee health nurse for the Crow Northern Cheyenne Hospital. And Mandy is the infection control officer for the Winnebago Comprehensive Health System 12 Clans Unity Hospital. So they're going to be our presenters this afternoon. So that's why I asked them, but anybody who is wants to come up and join the discussion is very welcome to. I do want to hear back from everybody. And now that I'm not presenting, I'll be able to monitor the chat better. So those of you on Zoom, go ahead and I think we're small enough that you may be able to unmute yourself too. If you want to join in on the conversation, that would be wonderful. So really the purpose of the discussion is first to get to know you in the work that you do for your tribe in infection control. And we wanted to give the opportunity to share your experiences and with each other in the room, because we find that a lot of times that's where we build the relationships with each other and say, hey, I didn't know you were working on that. Can I give you a call? Just building that network of where we can help each other out, and for everybody in the room as well as everybody on the Zoom. So to start, I hope you're not all shy. I wanted to start out and get to know you. If you want to let us know, we'll go around the room, let us know where you work and what your job title is. We'll start out small. We can't be too shy. Let us know your name, where you work, and what's your job. Yes, we'll start with you.
My name is so far it's been going really well. I'm new to public television, so get out there.
Thank you. Yeah.
I'm Sanchez Wilson, the director of Native Human Healthcare with the clinic here in Rapid City. And my reason for being here is learn about infectious diseases and developing a policy for our clinic. So this has all been very
great. Thank you.
I'm Julie Lewis. I'm from Oklahoma. I'm a member of the NIHB Project now, and I am their Indian child welfare coordinator, as well as their promoting safe and stable families. And so I come with it.
Yeah.
But part of our foster care oversight is to make sure that if there's an event of danger or national security, whatever, that we have an emergency in place for those foster children.
Okay, great. Yeah, thank you. And you step back in, we're doing introductions. I'm just your name and where you work and a little bit about your work.
My name is Carmen Sanders, and I work in the Tribe as a and then also my office is task force.
Okay. Yeah. Thank you.
My name is Claudia Gay. I'm the CHR director for
I think we're coming.
My name is David Holloway. I work for the NIHB Project in Alaska. I'm their HSC advisor, so health and safety for the
Oh, okay, great.
So, my background is oil and gas refining for the past 13 years. So I got tired of that work environment, I guess. So I'm currently working towards my occupational safety and health bachelor's degree. I did 2 years in the refinery and decided to go into this workforce instead. So yeah, I'm basically here to learn as much about NIHB so I can support our employees. We have medical departments, all that stuff. So,
Oh, great. Yeah, because Dina works at the employee health for her tribe. Yeah. Oh, to me?
Yeah.
Okay. Yeah. Okay. Okay, for those of you online.
Can you hear me?
Let's go ahead. You guys can unmute yourself and introduce yourselves. Let's start with Hope.
Hi, thank you. My name is Hope Jackson. I'm from the Ppe Tribe, the Goshen Reservation, and I'm Assistant Health Director for our Sacred Circle Health Clinic here in Salt Lake City. Thank you.
Oh, they couldn't hear.
Okay, this is Hope. Can you hear me? Hello?
Maybe we don't have audio. Hope, were you
Hope I can hear you.
I can hear Hope.
Okay, thank you. I introduced myself. Thank you.
Okay, so maybe we don't have audio. So if you guys want to put that same information in the chat, we're sharing our screen, so we can we might have to do it that way.
Can you hear me?
Oh, so go into your presentation,
Uh-huh.
and down in that bottom will be your left-hand corner. Under, go ahead and minimize the chat. Oh, it's unmuted. Microphone and video are both live.
Yeah. I think a couple of people have tried. Okay. Okay, yeah, I think they can. For those of you online on Zoom, you can hear us, correct? Now hear me? Okay, yeah, because we did, Hope, did you try to unmute and we didn't hear you?
Yes, can you hear me now? Okay, this is Hope. I believe the other people.
Oh, now we're fixed now, so we may have a little bit of echo, but it doesn't sound too bad. So, Hope, if you can introduce yourself.
Can you hear me?
My name is Hope Jackson. I'm from the Ppe Tribe, the Goshen Reservation. I am Assistant Health Director for our Sacred Circle Health Clinic in Salt Lake City, Utah. Thank you.
Thank you. And Danielle? If you're too shy to come off of mute, then go ahead and put the information in the chat.
This is Victory. Can you hear me?
Yes, we can.
All right. My name's Victory Johnson, and I am an ICU clinical coach and acting infectious prevention at Shiprock, New Mexico for the Navajo tribe.
Thank you.
I guess I'll go next. My name is Brandon Elkire. I'm a lawyer, and I am the state policy coordinator for the Minnesota Department of Health.
Thank you. Okay, does anybody else want to introduce yourself?
I'll go next. This is Andi Peters. I'm a registered nurse and the director of employee health and infection prevention for Muskogee Creek Nation Department of Health in Oklahoma.
Hi, thank you. Okay, if that's everybody who wants to introduce themselves, we'll go ahead and move on. I just have a few questions that I wanted to ask of the group and have you share more information about where you work. And the first question I have is, what does infection control training look like at your facility? So if we want to, if we can have Gina.
Good morning. My name is Gina Milligan, and I'm the infection preventionist and employee health nurse for the Corona and Cheyenne Hospital. So in the past, I think there was an infection control nurse. The trend is going towards infection prevention. Just saying that that we don't wait until an outbreak happens, that we're prevent it from the get-go. So I guess the title changing to preventionist. And employee health, the majority before COVID was geared towards more employee health. And once COVID hit, I think it became more important for more training, more competency, and we are due for our accreditation for JCO, for the Joint Commission, sorry. Now, and one of the questions that came up in our survey for CMS was, how do they know that I'm competent at my job? So that was very important to build into the job description. It became important for me to seek my CIC certification. So that's the route that I went. So I think before, a lot of the infection prevention training was done, the person before you taught the next person. If there was a gap, they kind of picked it up from the policies. One of the things that we have to do is make sure that our yearly policies are up to date. And with COVID, especially, we've had to do more staff competencies for everyone. When COVID first, when COVID first came, it was mass teaching for everybody, PPE training for every single person at the hospital, from our medical records people to the staff that in purchasing and referred care.
Sorry, Gina, I'm going to interrupt you really quick, and we're going to pass to this laptop because I think the audio is better for those online with mine. Okay. There we go.
Okay. All right. Can you guys hear me? Okay.
Yes.
Okay. So we went from okay. They said they can hear us. Okay. quick. So the training for the staff with COVID came for yearly PPE training. Everyone had to do the donning and doffing. And it was more, before we had the social distancing, we were able to do it in a big classroom like this. Everybody got the PPE in front of them. They did the return demonstration. And then we checked them off on it. And then after we had the social distancing, it was one-on-one every time we brought in a new employee, and our staff was roughly about 300. Now we're almost 400 staff. And then making sure that they come in with that knowledge. But for myself, what I brought in was from, I did infection control in an outpatient setting about 20 years ago. So that's how I qualified for the infection prevention and employee health 20 years ago. We, in the Northern Cheyenne Service Unit, they do have an urgent care facility, and that was more of a little standalone urgent care ER type thing, and then the outpatient. So I had done that and quality 5 years ago. But there was no set guidance, even within Indian Health Service. So that's why we relied a lot on going through the APIC and getting the classes from there. I joined the state APIC chapter, and then I got training from there, and then study groups. It was a real good outlet. I was in about 4 different study groups for that. So COVID, everything was kind of up in the air. There was, the only guidance was CDC, and you had to read it 2-3 times a day to stay on top of everything. Something you might have told them in the morning didn't apply by the afternoon, and everyone was confused. So that was one of the hardest things to do, was work on communication with staff on, this is the process today. You know, this is how you check into work. This is the door you're going to go through. This is, you know, you always have to have a mask. We still have to have a mask in our facilities to still encourage social distancing. But yeah, it was kind of pieced together from different people. So that was pretty much it at COVID. We've gotten a lot better now to where we do have competencies in place for people.
Yeah, that's what we hear a lot back, even in the room to others who have shared that it is that's one of the biggest challenges, is that everything's changed so quickly as far as the guidance and you know, pivoting right in the middle of your almost have it implemented and ready to go and in your plan, and then they change it on you. Yeah. Then it changes again.
So getting policies passed through our process takes months sometimes. So we just strictly went to protocols. This is the protocol for today, and then put it on the shared page for people to see. So yeah, they'd see me coming and go, oh. or incident command, you know, would issue different orders. So really truly, as the infection preventionist, I didn't offer any special guidance for COVID because nobody knew. I mean, it would have been different if there was somebody that I could call and say, what about this? But we were all learning as we went. We were learning, reaching out to different service units, saying, what are you guys doing about this? What are you doing about this? So yeah, it was. And we were really, really, really fortunate to have a good working relationship with our tribal incident command, and also as well as the county, and that really memorandums of agreement came together. So we all did everything. Once something came out new for Indian Health Service, the county and the tribe would follow along the same rules, so they weren't getting different messages from different entities, you know. So that was really good. So
Mandy?
Sure. The initial question again was how do we handle infection control in our facilities? I'll kind of take it back there and start with what we do with our employees. As most of us know, the infection control is a condition of participation for Medicare programs. It's also necessary for Joint Commission accreditation. One of the articles of the COPs about infection control is that everybody in our facility has a department-specific infection control training. We use health streams a lot since the pandemic has come about, because we can't do so many things in person. But one thing that I am working on within the last 3 years, we became a 638 hospital. We're no longer an IHS run facility. And so there has been a lot of rebuilding. When we separated from IHS, this was before my time. I've been with Winnebago for 2 years now. A lot of our teachings and our competencies, our testing, our training materials went out the door. And so the nurse that was there for infection control was tasked with rebuilding an infection control program. We have had a lot of turnover in this position. I think I'm the 5th infection preventionist at Winnebago since the tribe took over. Yeah. And so there are a lot of processes that were started and not continued. Under those circumstances, what I do is I spend a lot of time outside my office. I am in departments. We're talking about what's happening during the day. A lot of informal just-in-time training. I'm working on getting that education and that orientation program back together because, of course, with COVID, onboarding employees looked a lot different than it did under normal circumstances. So as far as my IC training for my personal growth, I learned a lot of infection control as a business owner. I had contractors that went out into the community and did blood testing, urine testing, other medical testing for insurance applicants. And so, you know, you kind of have to, it's not really an industry that has any oversight to it, but as an ethics position, you know, you want to do the right thing by your contractors and your customers. So I learned a lot about that way. Recently, before I came to Winnebago, I was quality manager for a hospice, and underneath the quality umbrella was also infection control. And as the quality manager and being such a small hospice, I also did infection control and all the other things that fall under that quality umbrella from time to time, employee health and things like that. You know, that was a big role as we were rolling into the pandemic and trying to meet needs. So, you know, that's where I got my toes in the water with COVID, which was a total different outlook from acute care. And so when I came to Winnebago, that was a whole other learning curve. I have been through the APIC courses. I sit for my CIC at the end of August. So I am so nervous about that. But yeah, I have just kind of tried to glom onto anything I could find through CDC. NIHB has been a wonderful Project Firstline Strive training. And then all the things on the guide part of the facilities, you know, learning Legionella and water systems and things like that. You know, a lot of it, you really have to be a self-starter and just learn everything you can. So I hope that answered what we're asking.
Yeah, thank you.
Okay, thank you, Dana and Mandy. Let's see. Okay, bear with me just one. Okay, I was just taking a look at the chat. Sorry, thank you for, while I get that back up on my side. When we transition through there. So we had another introduction in there from Winslow Indian Healthcare Center, Environmental Healthcare Manager. Thank you for joining us. And now, does anybody on the Zoom, did you want to share some information about what infection control training looks like in your tribal healthcare organization?
Yes, this is Victory. So I am at Northern Navajo Medical Center. Can you hear me?
Yes, we can hear you, Victory.
Oh, okay. I didn't think you guys could hear me. I was just going to mute me and not say anything. So,
thank you so much.
So I am actually an ICU clinical coach, and that is my background. I just came in as getting delegated into this position in the last 2 months. So I have no real infectious control background other than being a critical care nurse and understanding it from that point of view. With regards to what kind of education, you pretty much have to do it on your own. You have to reach out and try to get, your connections, get approval for education. And that is difficult, you guys know, working for IHS or for the government. I am just building what I know right now and trying to get connections for people that I can reach out to when I have questions. Part of the problem with the Shiprock service unit is that we have not had an infectious control person in here as a permanent for quite a while, like years. So it's kind of been piecemeal together. So there's really no great person for a resource. Right now I have 2 resources that work in other Shiprock service units that have held infectious prevention positions prior. So if anybody can help me, I would love it.
Just get my email and I will help you. This is Gina.
Okay, thank you so much.
I'm already helping another service unit down there. They just kind of hit me up when they have questions, but I will start having office hours 1 day a week for anybody that wants to join, so I can go over the basics with you.
That would be so helpful. Thank you.
Yeah, thank you so much, Gina. And that's really the purpose of why I wanted to have this open forum type discussion, to have that networking. Is like we mentioned, it's challenging as it is with COVID and having the kind of our hybrid system of in-person and Zoom at the same time.
This is Ppe Peters with Muskogee Creek Nation. I just want to put out there that, being a member of the APIC is very helpful. They offer the basic, classes for infection prevention. And then what I've included in my orientation here for the new infection preventionist is also CDC has it's called infection control for long-term care for nursing homes. And it is geared towards nursing homes. However, it contains the basic information for infection prevention. So it is very helpful also, and it's free.
Okay, thank you for sharing that. That's an excellent resource. Do you have a link that you can share?
Yes, let me get it and I will put it in the chat.
Perfect, thank you so much.
You're welcome.
And then post the Institute in the coming days. Any links that are shared in emails, if you're wanting us to help you connect with each other, we can collect the email addresses too, if you're willing to share that. Sure, and I'm going to turn it over to Gina again.
Okay, so APIC is an awesome resource. I didn't realize that our service unit was very lucky to have the money that they did to send me to just about anything I asked for. So if there's one course that you can afford to take, it would be from APIC, the Ppe 1 and 2. Okay. It goes over just everything that an infection preventionist should be doing in their job. Oh, can you hear me? Yeah, perfect. Okay. Okay. So.
Oh, I'm sorry about that, you guys. We are trying to, can you turn that off? Yeah. Okay, let's turn, so Gina shared the great information about the APIC, the EPI 101 and 102. And I saw that Victory, you mentioned that you're having trouble getting that paid for. That is something that you can apply for, the scholarships that I mentioned with the Project Firstline and NIHB. We once we get that scholarship to you, and it like I mentioned, though it is on reimbursement, but we can reimburse that. That is a great resource. I am going to turn it over to Gina again too.
So in the Ppe course, you'll learn things about what the infection preventionists should be doing, which includes construction. You need to be involved in any renovations, any new projects. Can you still hear me? Okay. All right. So I don't think people realize how involved an infection preventionist should be set aside from employee health. You should be involved if a new requirement this year from the Joint Commission is like a water management plan to address Legionella. Your HVAC systems, you need to know the basics about how your HVAC works, where to look for mold, the cleaning of that, everything from environmental cleaning. This course will go over that and how to report on the national level, what should be reported, along with what competencies you should be doing for your staff. So it was just a wealth of knowledge, and those were the class that I would recommend for everybody if you cannot afford to take everything from APIC. And I think
definitely take advantage of the scholarship that we have available with NIHB. We can cover those courses by reimbursement.
And their prep class through APIC is really awesome too for the test. So. APIC, and I think the Association for Professionals in Infection Control. Yeah. APIC. And I think they just had their 50-year anniversary this year too. It was started by a group of nurses that worked in ICU that seen the need for infection prevention. And they started APIC, and the CDIC is who you test through. That's also under APIC. So that's the national, if you're going to get your CIC certification.
Yeah, you don't have a infection preventionist right now. The position's been open for
a while,
longer than I've been there. So
I didn't realize what a rarity I was to have my CIC. I just knew I had to do it because I had to prove I was confident in my job. So the next 8 months of my life were, studying study groups, getting connected, and then taking that test. And I would really recommend
increase in that cost of travel for those 3 days, but I think their next 3 day is Monday.
Okay, sorry. Can you hear me now? Okay, yeah, we were just sharing the conversation in the room is about the APIC and what the organization is. So that's where the trainings are available. And the EPI 101 and 102 are the biggest, the most helpful for learning everything that you'll need to take the CBIC exam, which the CBIC is the accreditation. EPI 101. Yeah, Ppe. And EPI 102. And I know that that one is a bundled course too. So anybody interested in doing that course, there's a bundle where you can sign up for both of them, and once they're all self-paced and online that you can find there. And it's something that we do cover if you're interested, and if you're having trouble finding the funding to pay for it, then apply for scholarships. Or for anybody who in the leadership, if you know anybody in your organization that you would like to have take that, then reach out to us as well. And then we have some. Oh yes, we have a question in the room here.
Would you be able to put all of this information on one email or something?
Yeah. Yes. Okay. So sure. Yeah. So the question in it is. Yeah, we'll have some of the slides. So the question in the room is if we can put it all in one place, everything, because we've shared a lot of information. And Gina is going to be the presenter this afternoon. She has some of those resources in her slides. We will share the slides after the Institute is over on our webpage. And I will also send out a follow-up email for everybody who registered, everybody who's here. I'll send a follow-up email with acronyms and links, and it is a lot. So we'll definitely get you covered there. And also once I send out the email, you'll have my contact information, and you can always email me back or even schedule a call. You know, emails getting old. It's just not talking and not seeing each other. So I'm happy to also schedule a phone call as well. Mm-hmm. Yeah. So we are coming up at the closing of our time here. And so I just want to thank everybody here. So first of all, thank you for bearing with us with the with our hybrid and the challenges of trying to be on the Zoom as well as have in person at the same time. And thank you, Gina, Mandy, and everybody else who's shared information about infection control in your facility. So we will be breaking for a lunch break. I know everybody online may be in different time zones, but our break will be for about an hour. And for everybody in the room, we'll be in the same room when we come back after lunch. And everybody on Zoom, you'll have the same link. Just stay here, and we'll have our presentations after lunch. Thank you. Thank you, guys.
Since 1996.